As we move into the autumn, we are experiencing an increase in COVID infections in the community. This doesn't seem to be driven by a new variant. It's more likely to be due to people spending more time indoors and waning immunity. It is a concern, though, that the highest rates are in those age groups which are also at higher risk of becoming seriously unwell. And the COVID vaccine is still the best way of reducing the serious health harms caused by the virus. Because this is the first winter since COVID-19 emerged without restrictions in place, we're also a little bit concerned that flu might take a hold. And this is what we've seen in Australia, where they've actually had the worst flu season for some years, probably because of lower levels of natural immunity. And although what happens in places like Australia isn't necessarily mirrored in the UK, we need to be mindful of the possibility of having peaks of both flu and COVID infection at the same time. And the best way of protecting ourselves from becoming seriously unwell from either flu or COVID is to get vaccinated. But if we stay alert and keep doing those simple things that stop bugs from spreading, we can limit the impacts of a surge in flu and COVID in other ways. So, as I've said, the most important thing is to get vaccinated. And if you're eligible, have your autumn COVID-19 booster and your free flu vaccine, and just look out for your invitation because it will be coming to you. Wear a mask on public transport and in crowded spaces where you're going to be much closer to people you don't know, and it's a great environment for transmission. Hands, face, space, that still works against COVID, flu, and a whole range of other winter viruses. You can help blow viruses away by opening windows and letting in fresh air. Just keep air flowing. And if you do start to feel unwell, stay at home if you can and limit your contact with other people. There's lots of evidence that shows that taking these simple measures can reduce the number of deaths, hospital admissions, and infections caused by COVID and flu and slow transmission. Those eligible for the autumn booster COVID-19 vaccine include people over the age of 50 or 50 years and over, residents in care homes for older adults, pregnant women, and those aged 5 years and over who are at higher risk from COVID because of a weakened immune system or another long-term health condition. A booster is also going to be offered to frontline health and social care staff, those who care for vulnerable individuals and families of individuals with weakened immune systems. If you haven't come forward for your vaccination at all, or you had the first dose and then didn't have any further vaccinations, it's not too late for you to either start your course from scratch or complete the course that you had originally started. The autumn booster programme will be using the updated bivalent vaccine. Bivalent just means it provides protection against two coronavirus variants. So each dose of the vaccine targets both the original strain and the Omicron variant. The COVID-19 booster programme is being delivered by both GP-led primary care networks and community pharmacy sites, and there are 21 designated sites in Northumberland which are providing vaccinations, and they're spread across the whole county. You can book online using the National Booking Service or by calling 119, and new clinics are being added regularly as vaccine supply is confirmed, or your local GP practice may be using a local booking system. So if that's the case, you'll be contacted via your GP practice if they're offering this service, and you don't need to contact them. As we've said in previous years, please be patient. You will be contacted and you will not be missed. Where a GP practice or a local primary care network isn't providing COVID-19 vaccinations, patients will be advised by them to access appointments via the National Booking Service. Clinics offered by sites using the National Booking Service are uploaded and available to book online or via 119 when vaccine supply has been confirmed for those sites. So new clinics are being added regularly, usually weekly, as future supplies are confirmed. So keep checking back because you may be able to book an appointment in a location which is more convenient. GP appointments won't be visible on the National Booking Service, which may give the impression that the only available vaccinations are at sites which could be a long way away. This isn't necessarily the case, and if travel is inconvenient, patients should wait to be contacted by their GP or the primary care network to receive their vaccine more locally. GPs and primary care networks are currently prioritising the vaccination of our most vulnerable residents, so those people in care homes and those people who are housebound, before they move on to their wider patient populations. In Northumberland, patients can access a transport service provided by Age UK, as has been the case in earlier phases of the vaccination programme. So patients should be offered this service when they're contacted to receive their vaccination by their GP or primary care network. Anyone who's been offered a vaccination by their GP but hasn't been offered this service and needs it can contact their GP to inquire and ask them to book the transport service with Age UK. National letters or texts have been sent to all patients in eligible cohorts who are registered with a GP practice. Loads of letters have been sent out, and actually more letters have been sent out than there are currently vaccines in the system. But the supplies are continually being replenished and additional appointments are then offered for patients to book into. So be assured there will be enough vaccine in the programme for everyone who is eligible, but the supply is coming in batches. Anyone who isn't able to access an appointment in the first attempt should keep checking the national website and or wait to be contacted by their local GP or primary care network site. Nobody will be missed. More people are expected to get unwell with flu this year as less natural immunity has been built up over the last couple of winters when flu was prevented from circulating widely because of the other COVID-19 measures that were in place. The flu vaccine is being offered to people with long-term health conditions, people aged 50 and over, starting from mid-October, pregnant women, those people in long-stay residential homes, unpaid carers. So if you're receiving a carer's allowance or you're the main carer for an older or disabled person who may be at risk if the carer gets sick, close contacts of immunosuppressed individuals, frontline health and social care workers who can't get the vaccine through an occupational health scheme at work, all children aged 2 or 3 years on the 31st of August 2022, and all primary school age children and some secondary school age children. Those eligible for the flu vaccine can book an appointment with their GP or at a pharmacy which offers the vaccine on the NHS. They may receive an invitation to get the vaccine, but they don't need to wait for this to book an appointment. Anyone who is pregnant will be able to get the vaccine from either their maternity services or their GP. And children eligible for the flu vaccine will receive the nasal spray. Those eligible who haven't yet started primary school will get the vaccine at the GP practice. And children in primary school will receive the vaccine at school once parents have signed and returned a consent form.